you do if you were an employer? You do one of two things facing this conundrum. You're either going to downsize and get under that 50 employee thing, or you're going to downsize and get people under whatever it is, 30 hours. Sam, how many hours is it now that they're talking about? It's down from 40 to 30 a week.
It's 30 a week for full time.
Yeah, so you're going to get them down to 29 and a half or something, just to make sure you don't have to pay for those things. And employers are smart; they're going to figure it out. Doctors, there are going to be two kinds of doctors. There's going to be the ones who will only see a few patients in a straight fee-for-service kind of arrangement, or retire. And there are going to be doctors who see 100 patients a day. And when they see 100 patients a day, you're not really going to see the doctor. You're going to see a nurse's aide, or you're going to see a physician's assistant, or somebody else who's going to report to the doctor. One patient told me yesterday that he hadn't seen his doctor in 10 years. He'd seen all these other people. So the mechanisms are out there for business-wise doctors to make it, but a large number of them who are sort of stuck in their ways like me are just going to step aside because we can't do it. I can't see patients that fast and feel like I'm being a doctor. I'm just too stubborn, I guess. Anyway, what's going to happen to the public? They're not going to be able to find a doctor. They're going to wait in line. Or they're going to purchase private health insurance. All the other countries in the world, with the single exception of Canada, have a two-tiered system. They've got universal state coverage health insurance, or they've got private. I heard a story recently about somebody who developed breast cancer, wanted to get the mastectomy and get the chemotherapy started, was told it would be a 3-month wait in Britain, went home, mortgaged her house, went back, went in the other door, the private door, saw the same surgeon. Breast came off that week, was started on chemotherapy. She mortgaged her house. So, I mean, she was covered. Sure, she was covered. 3 months later, now what are you dealing with? So that's how the system works. Actually, you can save a hell of a lot of money if those people die. I mean, it's really a cost-effective technique to, those pesky people with cancer just sort of kick the bucket. What's the outcome of this? Let's see, did I miss something there? Oh yeah, the taxes. Public's going to pay large. They don't see it yet. They're going to pay big-time taxes. At the end of the day, the goal, make no mistake, is a single-payer system for the general populace. The government wants to be able to control every aspect of it. They want to say, this is what we will pay for that service. We're not going to deal with free market. We're going to, just whatever. The people on the other side of that are going to say, we're not going to provide the service because we're going to lose money on it if we provide quality. So we're either going to provide low quality, high volume, or we're going to walk away from the market. So you're going to get a bottleneck. People are going to need care, want care. They're not going to be able to find it. They're just not going to be able to get it. And not what they're really looking for. Healthcare will become two-tiered. There will be a private system. It's going to take a while to grow. I'm thinking about 10 years before the private system really gets up and going. It has everywhere else except Canada, and Canada's unique in that they made it illegal. So in Canada, if you want private health insurance, you go to Rochester. That's worse. There's a huge medical tourism business of people wintering in Florida, and they get all their health care stuff down there, and they send the bill to Canada. And Canada says you're not allowed to do that, but they pay the bill. So I mean, people figured it out. It's their own pocketbook. They figured it out. So you're going to get a two-tiered system, private, and then the rest of everybody. In Tier 2, you're going to definitely see shorter life expectancy. There's no way, I don't mean to be cruel, it's just necessary for cost containment. They're going to have to live shorter lives, or else the system doesn't work. We can't keep those people alive because it costs money. And money's not going to be there. Okay. Unintended consequences. Pretty clear there's going to be less investment in premature infants. Why do I say that? Because that's what's true in England and France and Spain and Germany and Greece and Italy and anywhere else you want to look at. You know, premature infants are not kept alive. They are declared stillborn. We go to incredible degrees to keep some of these babies alive. There's a beautiful girl in the paper the other day, 21, 22 years old, who was a product of the newborn intensive care unit at Christiana Hospital, born somewhere south of 2 pounds. And beautiful girl. Just thanking the system for keeping her alive. Wouldn't happen in those other countries. Abortion rates are going to go up. Why do I say that? Because they are very, very high in all those same countries. People are simply not going to spend time on a pregnancy or anything else if there's some indication that there are going to be problems. Either problems financing, taking care of the child, or maybe the heart isn't right, or maybe whatever. But it's not going to be rape. It's going to be choice. And they're not going to choose to have a female in China because you're only allowed one kid and you'd rather have a man. And China's got an interesting situation now because they don't have enough women for their men.
What about birth rates?
Birth rates I assume will go down just because they have everywhere else in the world. Our birth rates are falling anyway, but I'm just assuming that it'll accelerate that. I don't know if that's, I suppose you could put it off as an unintended consequence of the law. Certainly shorter lifespan for cancer. There's no way around it. You cannot spend that kind of money and have the outcome always be a painful, horrible, hairless, vomiting death. We're just going to figure a way to do that in a different fashion.